So hi everyone, as Joanna said, I'm Hani, I work with the Child Protection Working Group. The first 12 slides are more focused on information management, which is kind of a larger umbrella topic, and assessments. Some believe fits underneath information management, some believe that it's a separate area of work, but regardless of that, what I'm going to do is I will just give you a very short brief of what the first 12 slides, which are focused on information management, cover. If there's any questions about them, I'm happy to take them, and if I can, I'll answer after the process of presenting the 12 slides, and then I'll try to quickly move into the rest of the presentation, which is focused on assessment. So the first 12 slides, which I'm not going to go through, the three key issues that I thought they want to tell you or present to you are one, it kind of tries to help the audience understand how to develop an information management system and what it requires, which is focused on the issue of knowing who needs what kind of information. So basically, defining and finding out the information requirements existing in the context of an emergency or a humanitarian context, and then try to find out how to find those information, and then thirdly, try to find out what is the best way of sharing those information to reach the right people. So that's number one, basically developing how to develop a strategy, an information management strategy. The second main issue that it covers is why should an information management process be coordinated? And it tries to give you an idea of what are the benefits of coordination in information management. But in brief, what it is that information management tries to create an overall picture of the situation. And since you have several components filled in by different organizations, by different actors, unless you basically put them together in a coordinated manner, you're not going to see the entire picture. You always have these smaller parts of the picture if you don't coordinate it. But that's kind of the general message. It's not presented in that way, but that's kind of what it tries to say. And then lastly, the third issue that I thought is important to raise is the ethical considerations in developing an information management system, which is mostly focused on two issues of confidentiality and do no harm. So making sure that, especially if you're dealing with individual information related to individuals, which is either when you do assessments and collect information from people, or when you do you use something like the Child Protection Information Management System, which collects information about individual cases for the purpose of sharing and making sure that the response to that individual case is coordinated. Confidentiality of information becomes really, really important, and development of protocols and all that is key. And then do no harm, as we all know, is one of the leading principles in our work, making sure that whatever we do to collect information or to share the information is not putting those who provided the information to us or those about whom the information is, or those who are collecting the information are not being put in harm's way. Aliasha, I don't know how difficult this is, but because I'm not going to go through the slides of information management, I just want to see if anyone has any questions for this 12 first slides. Otherwise, I'll just go to the assessment part. So From slide 13, we have the focus shifting to the Rapid Assessment Toolkit, which, as many of you know, is a toolkit that was developed by the Child Protection Working Group in collaboration with many of your organizations and possibly some of you. And it's being piloted. It has been piloted in several countries so far. In some countries, better results came out. In some countries, some of the weaknesses came out. And so we are learning through the process and trying to adapt it and revise it and make it better and better and more user-friendly. I know there are still some glitches in the tool, but overall we are receiving very positive feedback from the field in terms of its use as a rapid assessment tool. If you can go to slide 14, it basically provides us with a summary of what we can expect from the Child Protection Rapid Assessment and what we cannot expect from it, basically by saying what it is and what it is not. It's basically providing us with a very general snapshot of urgent child protection-related needs. It tells us about what we call good enough information. So we're not talking about perfect information. We're just talking about good enough information when we're dealing with the Child Protection Rapid Assessment. And then hopefully a stepping stone for our future assessment. In many cases, we don't have any baselines to base our analysis on. Hopefully, this will provide a baseline for future assessments and information management related activities. And what it is not is that it's not a comprehensive assessment or monitoring mechanism. We don't do program monitoring using this tool. Parts of the tool can be used as building blocks of those systems, but it's not. This tool is not designed for that. It does not provide us information that you can generalize to the entire population, mostly because of the sampling method that we use, which I'll explain, but also because we are very focused on very specific issues in a very specific part of the population. And it's not meant to inform long-term programs. So if an organization wants to do 2-year or 5-year programming, we do not recommend the use of this. Although, again, this can be used as the core of an assessment activity that we will do, but you will need to complement it by other more in-depth methodology that would help you get a better understanding of the situation so that your long-term programming is based on valid evidence. And otherwise, you may risk very volatile systems, volatile context, showing you something in a snapshot through the Child Protection Rapid Assessment, and then you programming for 5 years, and then 2 years finding out that things either have changed or your knowledge was not in-depth enough. Can we go to the next slide, please? Great. So it gives us a sense of the scale. It does not tell us how many children are separated or how many cases of sexual and gender-based violence happen, but it gives us a sense of the general overall scale of the situation. Is separation an issue in this specific context or not? It also helps us, to a certain extent, find out where the priorities are, especially in the early stages of an emergency. You need to prioritize your funding, so you try to focus in areas where you determine as a priority through the rapid assessment. And to a certain extent, it helps us find out where the existing capacities are so that we can base our programming on that. Can we move to the next slide, please? In terms of timing, it's really dependent on the timing, on the nature of the emergency. We specifically say that in rapid onset situations, you have to allow a certain amount of time. We normally talk about a week, which will take you to prepare for your assessment anyway, for the situation to kind of settle in. And the reason for that is you need, because your main medium of acquiring information is through key informants, in this case, you need the population to start understanding what is happening to them. If you do not have a population that knows what is happening to them, they're not going to give you that information. So if you go into an earthquake-stricken area a day after the emergency, and they're busy digging out bodies from under the rubbles, you are not going to get, first, it's not an ethical way of doing it because their priorities is different. And second, they're not going to know what has happened to them. It hasn't sunk in yet. The same thing with displacement. If the population is displacing, you need to let them displace and settle in their target area, and then a week later. Again, this is rather arbitrary, this week that we are talking about, but we're using it as a standard. And if the emergency is recurring, then you basically don't have a starting point to base your 1 week standard on, so you just basically go anywhere, any time that your analysis allows you or tells you is a good time. And in terms of coordination, you make sure that it's an interagency effort. It's always bringing us much better results, mostly because the resources that goes in is more, and also the knowledge that goes into the process is stronger and more diverse. So it's normally end up with much better quality results if you do it in an interagency manner. So we recommend that you establish a task force, an assessment task force after an emergency, to make sure that that this happens. And then, Alyosha, next slide, please. And information management technical expertise is pretty important in here, within that task force. The next slide has one extra bubble, which I'll tell you which one it is, but it's basically, it should be 6 bubbles. This is an older version, which I don't know how it ended up in this module. So the steps that we need to go through to plan and implement a job protection assessment starts with establishing your task force, adapting your tools, which I'll explain a little more, and the WWNK stands for what we need to know, which we basically take as the core of our tool. Everything else is based on what we need to know. And I'll talk about it a little more. And then an assessment plan needs to be developed, especially if you're talking about an interagency activity, for everyone to have the same understanding of what is going to happen and how it's going to happen. You need to have an assessment plan developed in conjunction with everyone else. And then there are specific details of what are the components of an assessment plan that I can share with you. And then recruit and train your assessment teams. The next step, which is agree on main parameters, is now under the assessment plan. And what it was that in certain cases we have seen that because the group has not agreed on how the results of the assessment is going to be disseminated, different parties within the assessment task force decided that they don't want the report to be disseminated, written up and disseminated. So it basically kind of got stalled, and all the efforts, or the effort partly went to waste because we never had a report produced so that people can use the report as the basis for their programming. And then the next step is carrying out the data collection, which is a big part of the whole assessment. But as you probably have seen, most of the time people assume that assessment is about carrying out data collection and dismiss everything else within this process. So one of the things that we want to take out of this slide when we do training is that carrying out data collection, and I specifically made it pretty small, to make sure that it's understood that it's one part of a whole process. And if you do not do the rest, if you do not train your teams, and if you do not have a methodology for sampling, if you do not adapt your tools, if you do not do proper analysis and interpretation, it doesn't matter if you collected data or not. You're not going to have the results based on which you can do programming. So it has to be, data collection has to be one part of a whole process. Can we go to the next slide, please? Yes, sir. So the components of the assessment, the rapid assessment toolkit, are three main components, which is the short guide that I don't know if you have seen it, but it's on the Child Protection Working Group website. And the second one is the group of sample tools, which we'll discuss a little more. And then the third component is the data management tool, which is hopefully making analysis much easier. And within the short guide, we have several components. Just a few examples of them are, it tells you how to coordinate and plan. It gives you a bit of information about how to sample. It gives you a bit of information on what data collection teams should look like and what kind of background they should have. And it tells you about interpretation and analysis and interpretation, very basic issues, and then report writing. And then the sample tools are basically there's five of them. You have a tool that helps you with desk review. It's more of a checklist. You have a tool that helps you with direct observation. You have a tool that helps you with key informant interviews, and then a site report, which I will explain what the site report is. And then you have urgent action form, which is basically urgent action process is a process that through which we make sure that if our teams will go to the field to collect the data, come across a case that requires an urgent action. So if a child is in a situation that his or her life is in danger or it requires immediate action, then we are obliged to take action. We cannot just leave the child and say, this is not my job. We do not actively seek those cases, but if we are referred to one, we cannot just turn around and say, oh, my job is to collect data, I can't deal with this. So we have to, within the guide, it explains how every country that wants to do assessment needs to develop a standard operating procedure and use an urgent action form. So there's an example of that within the sample tools. And then going back to the site report is I would call it a methodological innovation within this tool, which is basically trying to bring every information that has been collected in one specific site through key informant interviews and direct observations and put them into one report. So each site that you visit, in which you may interview 4 people or 5 people, or 3, the minimum that we put out is 3, and then do a couple of direct observations, one maybe in the morning, one in the afternoon. You bring all of them together in a daily debriefing session, and you put them all together in what we call a site report. And then what we analyze is the site report. And I can explain a little more why this was decided, and we're still trying to perfect this. but we still think that there's a lot of value in having the site report as an intermediary step between the data collection and data analysis. And then the last component, which was the data management tool, has it's an Excel-based tool. It has 3 different components under it. You enter the data. It automatically gives you basic frequency analysis, and it automatically gives you basic graphs. It has been helping a lot of field-based operations who do not have the information management expertise or capacity to do the basic analysis, to basically just get it out of merely inputting the data that comes out of the data collection, and they get basic analysis. Of course, that is not enough in many cases, but it's good enough in many cases. Can you move on to the next slide, please? So I'll do this slide, and then I would like to open it for a few minutes to. Okay, I have 5 minutes, so maybe I'll just rush through it and then open it for questions. So as you see, this is what we call a what we need to know cycle. And as I mentioned, what we need to know, which is symbolized as WWNK here, is the base and core of our assessment tool. And it sounds trivial to, whenever you want to do an assessment, first think about what are the things that you need to know. But you would be surprised how many times I have received a request from the field office to help them with their assessments, and I ask them about, so what is the process? What do you want to know? And they say the situation of children, and I say, but that's not enough. We need to know more. And they say, no, there was an earthquake and children were affected, so we want to know the situation of children. So very general thoughts, and a lot of the time it's driven by the fact that a donor or a head of an agency thinks that assessment needs to be done, and then they mandate it to their child protection section, and the child protection section says, okay, then we do an assessment. But they don't think about the details of what that means, what the situation of children means. And that's why we put so much emphasis. So one of the things that I want you to take out of this presentation is the importance of starting every single process of an assessment from revising what we need to know. So we want to make sure that based on the context and based on what has happened, which calls for our attention or for an assessment, what we need to know are revised and gone through actually several revisions ideally, and then everything else starts. So before what we need to know are revised, nothing should happen. And there is a list of 19 or 20 what we need to know, and what we need to know are not questions. They're topics. There's the issue of separated children, there's the issue of sexual violence, there's the issue of physical harm to children. And then so as you see in this cycle, out of each what we need to know, you may have one or several indicators that comes out. And then out of the indicators that you have, you may have several data elements that you need to collect. And what we need to know is, and indicators and data elements are very much connected. You can't really separate them. You think about the issue, you come up with an indicator, the number of children that are separated, or the number of registered children who have been reunified, or the number of registered children who have been sent into an interim care center. All of those are examples of indicators, but for some of them you need to collect several points of data to give you the overall picture. So if you want to know about the issue of separation, sometimes you need one single question, but oftentimes you need 4 or 5 different questions in your questionnaires, and some of them might be in direct observation, some of them might be in taking from an interview to be able to see the issue of a picture of the issue of separation. And then the next step is adaptation of data collection tools, which, as I said, is something that starts from what we need to know and then moves towards adaptation of tools. We do have within the sample tools, as I mentioned, we do have sample questions. They're pretty developed. We have tested them in several contexts. So we know that a lot of them are relevant in many of the contexts. But again, we put a lot of emphasis on adaptation. Adaptation, which again, as I said, starts from what we need to know, is probably the most important part of the process of preparing for data collection. So before we get to data collection, I would say the process of adaptation is the most important process. And then you collect the data, you compile the data, and send it for analysis and interpretation. Just want to quickly talk about the difference between analysis and interpretation. Most of you would know this, but it often gets neglected in the field. Analysis is making sense of the data. There are slides in this presentation, but I'm not sure if we will get to it. But analysis basically just tells you what the raw data that is coming in is telling you. And then interpretation is the process through which you make sense of the analysis. So basically, the graph that you see is just a graph, unless you have people who have knowledge of the local context, and then they basically look at the graph, which is basically just numbers, and bring out some meaning. And that process is the process of interpretation. And that's how we can reconnect what we find in an assessment to our programmatic activities. If you do not do an interpretation and just use analysis, you're basically missing a step, and we may not end up with the best programs. I can make a lot of examples. There are examples of interpretation within these slides. But just to quickly go through all the slides, Alyosha, can we go through the next one, which is basically just more explanation on what we need to know, and then maybe the next one. So as you see, we explain what we need to know as a series of unknowns and little knowns that we wish to learn about. And then the next slide talks about series of topics within the what we need to know. These are not the actual what we need to know. And then there's an exercise that helps the participants understand how the process of adaptation of what we need to know happens. Through this exercise, we give different groups every single what we need to know, that the generic what we need to know that we have developed, and they go through a process of adapting them to their context, or getting rid of them, or adding to the what we need to know. And the next slide shows the template for this. So the proposed what we need to know, there's a handout for this within the package that Joanna sent. So you don't need to produce it, it's there. And then each group, so the way it works is each group will receive every single page. So there's one set of all the what we need to know that goes around the room. And each group will say, I agree with this, I don't agree with it, I want to reward it, or rephrase it. Can we go to the next one, please? Okay. Takes you back to the cycle, and it tells you that the optional slides, which are the more technical issues, should be inserted here. So if you have received the optional module, so it comes here if you want to talk about it. It requires much more in-depth discussion and more time for us to go into that one. But it basically just gives you a general idea of the technical issues behind the rapid assessment. Alyosha, can we move to the next one, please? yes, this is what I was talking about. This is where you put the slides for technical considerations and sampling. Just quickly to tell you about sampling, we use purposive sampling, which is a non-probabilistic sampling methodology for this exercise. So it's not, that's one of the reasons that we cannot generalize the information that we collect. What we have to have a sampling strategy. We cannot do it the traditional way of, okay, I get into my car, I go into the first camp that I get to or first village that I get to, and I interview the first person that I come across to. We have to have a strategy on who to select, what sites to select, why, and how they're different. If there are different sites or villages that are affected differently, we separate them from each other and select sites within each of those. There's more detail about it in the guide. Can we move forward, Alyosha, please? The next slide is just a funny slide that tells you that collecting too much information is not key for success. You may end up with too much information that you can't even process or analyze, so it's basically waste of time and waste of energy. And one of the reasons that the unit of what we call a unit of measurement within this process is community, is to minimize the amount of data collection. So if we can, unit of measurement could be individual, could be household, could be community. But we stick to the community to make sure that we do not have too much information collected that is out of our capacity to handle. And there's a information management pyramid that basically says at the top of the pyramid is where you have the community and you have less volume of data collected. And then as you go down, you get to household, you get to individuals. The volume of information gets more and more. Let me just quickly go through the rest of them to see if there is anything that I need to emphasize on. I mean, there's a lot of things. There is a whole 3-day training that we're trying to do in 25 minutes. No, I think I tried to cover the things that are very important. Just to quickly wrap up the very important issues, and then we'll open for questions and discussion. As I mentioned, one of the most important, or probably the most important issue before we get to data collection is the issue of adaptation, which I mentioned. I know I've mentioned this 70 times so far, but it starts from what we need to know and goes through the whole process of getting to the tools themselves. We never do an assessment without adaptation. So that's the message that you want to get across. The second issue is sampling. We want to have a sampling methodology. We don't want to do it in a haphazard way. We don't want to just walk into the sites and talk to people. We do not use focus group discussions, and we do not talk to children, and there are very specific do no harm issues related to that. And we know that focus group discussions are very good methods. We know that it's important to engage children, but we cannot ensure that these are done in the proper way in the context of a rapid assessment. So to avoid harm, we basically decided that in the context of rapid assessment, we are not doing focus group discussions, and we are not talking to children. And then one logistical issue is that the experience has shown that if there is no one individual or one I'm receiving threatening messages. If there's no one organization or one person who leads the process, we often end up with not a very high quality end result. So now, as you suggest, we open for questions and discussion. Thank you for listening to my rambling.
Great, thank you, Hani. We have a few minutes left, so people will be unmuted now so that you can ask questions directly to Hani. If I could just remind people, if you're on speakerphone, could you come back to your individual phone in order for the sound quality of the recording to be fairly high?
Unmuted.
Are there any questions for Hani?
I have a question. Hani, you said the tool is on the Child Protection Working Group website. I'm not finding it.
Okay. Very good question. Sorry, I meant to mention it, but it's only there's only the guide on the website.
Oh.
And the reason for that is we have seen it misused in the sense of those who don't know how to use it or have not been briefed on it. They take it and just take one part of it, and then in the report they say the Child Protection Rapid Assessment tool was used, whereas they only picked a part of it. So we make sure, I don't know if you have seen, but there's an information page that says, get the actual tool, contact Hani Mansourian. Everyone can contact me, and I'll give them the brief, make sure that they know that they have to adapt it, they have to do sampling, blah, 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 and then send it to them.
If I could actually follow up with that, this is an area that's changing quite rapidly. It changed extremely rapidly last year, and it's continuing to evolve fairly quickly. So if any of you are doing an introductory level training that includes assessment, feel free to take what I've sent you, these modules, but also to be in touch with Hani either directly or through me to get, some tweaking over the coming year, because it's sure to evolve over the next 12 months as well.
And Joanna, if I may, we are also, with the help of Joanna, in the process of finalizing 2 full-blown training modules on the rapid assessment, one for coordinators and managers and one for data collectors and evaluators. Those also will be available soon, hopefully.
Hi. Can I ask you a question, Hani?
Sure.
I'm sorry, the connection is really bad, so I'm not sure if someone already asked this question or what the kind of discussions are going on. But Hani, I was in touch. Lucy connected us. I'm Nadine from the Jordi Kandar office, and we're adapting the Child Protection Rapid Assessment tool to do it for the emergency response team for the Syrian refugees in Jordan. And I was wondering if we are able to get a copy of the management and the Excel sheet of the data management and entry, because I do not have that. Is it possible that you send me this? And there's one thing, when we adapted the tool, we actually took 2 components. We will not be asking any questions regarding to sexual violence, nor any questions on recruitment or involvement in armed groups, because those are very, very highly sensitive, and we'd rather avoid these questions in such interviews with KIIs.
That's absolutely fine. That's not one of the things that we discourage people. We actually encourage people to. That's a part of adaptation, and that's very much encouraged. That's a great thing that we do.
Okay, great. So I'll send you an email so I can get a copy of the discussion.
I'll be happy to.
What if people offer all that gender-based and child recruitment information?
Sorry, I didn't hear.
Joanna mentioned that we might not be assessing these sensitive issues, but what if the information is offered? I'm sorry, Joanna.
There are sections within the tool where you can take notes of the things that are mentioned, but we're not within the questions that you ask or within the answer option. But it's going to be much more of an ad hoc process, you can't really plan to analyze them. If you start receiving a lot of the questions, a lot of that information, then you can devise a plan to analyze those information as well. But it normally ends up being at an anecdotal level, which is not really analyzable. But you can use it for further assessment.
It's Joanna here. I'm just going to jump in. One of the tricky things I find in training on this topic is that it's very detailed. We're getting more sophisticated, which I think is wonderful. And yet at an introductory level, this is not the assessment training. Based on this, just like in our psychosocial module for introduction, you can't go out and be a psychosocial worker. You can't go out and run an assessment based on this 90-minute presentation that Hani's just quickly run us through. So to me, the trick in training at this introductory level is to help, not to overwhelm them with too many details and feeling, oh, this is going to be too complicated, we're not going to do it, but give them the teaser, make them realize what they don't know and what they could know, so that they invite Hani or someone who has, maybe yourself, to come back and do a more specialized training on the assessment toolkit. So I think when people are looking at running introductory sessions, whether it's for an individual agency or multi-agency, it's to help find that balance for people between, upping their game but not overwhelming them with, thinking this is too complicated and too much and, we can't find the time to do it and so on.
I'm afraid that what you were saying shouldn't happen. Might have happened. I might have overwhelmed the audience, or maybe everyone knows this topic pretty well. But yeah, I just echo what you said. It's a difficult topic to bring into a short briefing, just because there's so many issues that you want to make sure they don't do wrong. At the same time, you don't want to give them too much details that would overwhelm them. So it's a rather very, I'm finding it very difficult to do a short training on this and get good results.
Yeah. I know that when I start my training sessions on assessment, just as the introduction, we have 90 minutes or something like that with people, I ask people, have you done an assessment? And almost everybody puts up their hand in the kind of groups that I'm working with. And we start looking at, did it work well? What were the challenges? And people have loads of complaints. And that's how I enter into, look, there's a newer tool that helps deal with those kind of situations, that gives you much higher quality results. It does take a lot of work. It is interagency. It really, expects more of you. But there's a clear path that you can learn how to do it and implement it and so on, and people are really keen. So I think there's lots of interest and lots of relief when people think that there are better tools out there or better ways of doing the work out there. The biggest thing that people always come back and say in trainings is, well, it takes so much time, and then to do it together, if we have 7 agencies, the ministry in this organization and that agency and so on, it's that part overwhelms them, I think. So maybe we need to think of some tips of keeping them motivated to be working together as they do this.
Yeah, and there's this, I'm sure you have seen it, all of you, and there's this tendency of falling back on focus group discussions in our field, especially in protection. It's much more than, and I think education as well, but there's a tendency, everyone likes focus group discussions, and it's partly because our area of work is rather qualitative, and focus group discussion is a very qualitative method. But maybe I'm exaggerating a little bit, but not too much. 99% of the time that focus group discussions are done, the ones that I've seen, are done not properly. They either were not conducted properly, in the sense of the facilitation was not done correctly, or the analysis was not done correctly. So you will always be bombarded with questions about why are we not doing focus group discussion, why are we not doing focus group discussions, and you need to really think about it and kind of read the material about that that issue to be able to respond convincingly. Why, in a rapid context, we're not using focus group discussion. Again, we're not saying it's a bad methodology. It's a great methodology. I personally really like it, but it's not appropriate for when you don't have time to train and you don't have time to analyze.
As you can tell, Hani is happy to be connected or contacted individually. He's off to Burkina Faso tomorrow, as I mentioned in the email out to everybody, so he might be busy for the next week or so. But he's contactable, yeah? Hani, do you want to put your email address into the sidebar so people can have a chance to contact you directly?
Sure.
So I want to take this chance to wrap up by saying thank you to Alyosha, who's, as I mentioned, doing this from our Bangkok regional office. And also a big thank you to Hani, who prepared this just before he headed off to actually carry out the assessment training and support the team in the Sahel as it deals with the nutrition crisis there. As well as, I should mention, today is Persian New Year, and so we should be wishing Hani a Happy New Year. And anyone else who's online who's celebrating today, whether it's the arrival of the New Year or the arrival of spring. And then it will take a little while for this WebEx to be posted up, but do check back regularly on the CPWG's YouTube channel.